Pharmaceutical companies have hiked prices on hundreds of drugs. People will see a 4% increase on more than 850 drugs. That includes everything from COVID-19 vaccine to Ozempic, despite Trump's efforts to keep the prices low. Now, remember, just a month ago, he guaranteed that people would be paying less. Just take a listen.
The world's largest pharmaceutical manufacturers, all very big names, celebrities in their own right, very, very powerful people, and they head some of the most admired companies anywhere in the world. It's a great group. To announce that they've agreed to offer many of their flagship drugs, really all of their flagship drugs, at heavily discounted, most favored nations prices. In other words, whatever the drug sells for over the world, in the world, whatever the lowest number is, if it's Germany, if it's in UK, anywhere, we will match that price.
46 Brooklyn Research, a drug pricing nonprofit, says the changes implemented as of January 9th are on par with the amount of drug companies that raised prices in 2025. List prices typically are not how much consumers pay at the pharmacy counter or for mail order prescriptions. Factors such as rebates, insurance discounts, and co-payments, deductibles, and co-insurance all determine how much people must spend to pick up their prescriptions. Annual price hikes are less than they were a decade ago, when yearly increases typically exceeded about 10%. Drug companies are also launching new brand name drugs at higher prices. Let's bring in the panel. Let's talk about this. We'll start with you, Dr. Kirk. We're talking about 850 drugs, at least 4% or higher.
It's heartbreaking. It's heartbreaking. And what makes it so disappointing? What really makes it so heartbreaking is that progress was being made. We know that we know that healthcare costs are significantly higher in this country than what they should be. And they never went down to where they should have went down under the ACA. And now they're going back up again for millions upon millions of Americans. We know that we're paying more for pharmaceuticals, for the life-sustaining medications that we need in this country that we shouldn't be paying for at that rate. And it's only going up because we, the American people, we missed the moment. I'm talking to every single person watching the show. I know you're out there saying, I voted the way that I should have voted. I voted for fucking Kamala Harris. I did too. I know that's what you're saying, and I'm saying I did too. But we're a democracy. We rise together, we fall together, and we have certainly fallen. And it's just heartbreaking. With anything around healthcare, around medical treatment, around pharmaceuticals, and the prices that the people are paying, it breaks my heart. It breaks my heart. And it's only getting worse. And it's only going to go up because we have an administration in office who's determined to make the rich richer while the rest of us suffer immeasurably.
Rebecca, what are your thoughts? Are you in agreement too?
Implement tariffs on the majority of countries around the world, including countries where some of these very key drugs are manufactured. Because that means when you import those drugs that are manufactured in foreign countries and you try to import them into the United States, if you have a 150% tariff, if you have a 25% tariff, guess who ends up paying that tariff? It's not the country that is exporting it to the United States for the United States to import it, but it's going to be the end user. It's going to be the consumer. It's going to be the customer. It's going to be the patient. So it's not surprising that we're seeing drug prices trending in that direction. We also, from a policy perspective, Dr. Kirk is right. The first step with the Affordable Care Act was to bend the cost curve to make sure that people have access to decent enough insurance to be able to access healthcare. The next step was dealing with prescription drugs. So yes, we saw in 2022 when Congress passed, I think it was under the Inflation Reduction Act, which allowed Medicare for the first time to directly negotiate the price of drugs. Well, that's great for Medicare, but when we're talking about prescription drugs in this country, Usually, this is where we need the president to not piss off the entire world. So the president could then negotiate drug prices across borders. But threatening people, threatening companies isn't the way to do so. So when you have this chaos in Washington, in which the way that we see that this administration, or someone said in the comments, this current regime is handling its business, it impacts everyone. This is the latest and probably what's in a long list, a long line of things that are going to directly impact the American people in their pocketbooks because of the person who is currently on paper leading our country.
When Cooney, Pfizer's COVID-19 vaccine jumped 15%.
15%, and unfortunately, that's probably just the start. I
Mm.
think that we're going to continue to see a rise in these prescription prices. And I really want us to pay attention to the fact that the United States healthcare is a paradox, right? We continue to excel in innovation and in science, but we continue to perform poorly due to high cost. We don't have universal coverage. We have significant inequalities, and we're often ranking last in healthcare outcomes, access, and equity compared to other high income nations. I mean, again, the United States continues to flounder on the world stage when it comes to healthcare. And this particular administration or regime, as Rebecca mentioned, is not helping that at all, I think, unfortunately. And in President Trump's rush to dismember Obamacare as much as he could, he unfortunately and effectively, took away health care from so many Americans that were receiving it under the Affordable Care Act. And it's really a sad thing when you let pride and ego take away from the rights, and I consider healthcare a right, that Americans have to receiving affordable and equitable healthcare here in this country.
Dr. Kirk, it wasn't too long ago where Trump promised that Americans would be paying less for prescription drugs. What happened?
He lied. That's all this man does is lie. He lied to the American people. He knew damn well he had no plan in place for anything, nor did he even have concepts of a plan. All he had were well-defined lies and well-developed lies, fictions that he was going to sell to the to American public. Flat out wolf tickets. Wolf tickets. And that's what we're living in. This man also said he was going to bring down prices. And we are now living in an affordability crisis. We literally saw, and I forget our United States Secretary of Agriculture. I was astounded to hear this woman say today that the American people need to be living off of $3 per meal. $3 per meal. In Trump's America, you cannot even afford, please forgive my French, my flat out English. You can't even afford to wash your ass. You can't afford it. You make $7.25 per hour as minimum wage, yet soap costs over $5. Toothpaste costs over $5. The deodorant is over $5. You can't even afford to be hygienic in Donald Trump's America. You have to work 2 hours or more just to wash your peach in Donald Trump's America. There is no affordability. He lied. He told a flat out lie to the American people, and the American voters bought it hook, line, and sinker. Well, the ones who really voted, who got up and voted.
Rebecca, talk more about the impact that this prescription hike will have on our community.
Sure. One of the things in the Affordable Care Act, I don't know if people remember this from, this would have been, 16 years ago, 17 years ago, the whole idea of closing the donut hole. Because we know my dad is about to turn 76. He, like other people of his age group, that means that they're on Medicare. That's the government insurer, which they're able to access health insurance that way. But part of Medicare, we know there's Medicare Part A, which I think is hospitalization. There's Part B, there's Part C, but there's Part D. If I remember correctly, Part D is for prescription drugs. And so there was this concept of closing the donut hole, meaning as we all know, if you have health insurance, you have to pay so much until you hit your out-of-pocket maximum, you pay. You have, even with healthcare insurance, you have to pay until you now hit that threshold, and then 80% or 100% of cost then is absorbed by your plan. And so the larger that gap is between how much you're paying until your insurance plan kicks in and covers the additional costs, especially of your prescription drugs, this is going to impact a lot of people who are in retirement. Because when people plan for retirement, those who do, generally you're planning 20, 30, 40 years in advance. This hazardous increase in healthcare costs and prescription drug costs simply wasn't a part of the plan. People didn't expect that they're going to have to set aside even more money outside of, if they still have a mortgage or if they're paying rent, outside of rising costs of utilities. So when the overall cost of living is going up in this country, and then on top of that, you have healthcare costs, you have prescription drug costs that are going up at an even higher pace. What's happening, like Dr. Kirk said, some people can't even afford to wipe their behind. And Dr. Kirk, I would argue there are some people of different persuasions who weren't wiping their behind anyway. But for those of us who are inclined to do so, things are just getting so expensive. Things are getting out of control. And that's something typically we ask Congress to step in, because this is now an issue of national import, of national importance. Instead, just like with the clips we saw earlier, Congress is debating whether or not they're going to pull the Clintons in front of a congressional committee, which really isn't going to move the needle on any type of national policy. And so right now we're seeing a very unresponsive Congress. We're seeing a delusional resident in the White House. And so right now it's uncertain times for many Americans in this country.
Linkuni, I want to go back to you. The diabetes drugs, Ozempic, Mounjaro, they very, very popular. They're up 3%. And then you also think about the fact that employers really, many of them don't even cover these drugs.
Yeah, the semi-glutides are on the rise right now, and I think the really interesting distinction is that they're covered for diabetes, but not as a weight loss drug, right? And so a lot of folks are kind of in limbo, but I think what we're missing here is that obesity is a huge crisis within the United States, particularly within the African American community. So, from my vantage point, you shouldn't have to have diabetes to receive a prescription to these drugs, because really and truly, and your insurance should cover it. That's the important part. You could still get it, right? You can still purchase it out of pocket, but your insurance should cover it, particularly if you're suffering from a condition like obesity. That's a real condition with real comorbidities that really persist, particularly within communities of color. And we have to pay attention to that. This is the medical apartheid that was written about. This is this sort of social disenfranchisement that we're paying attention to, is that when you say that people can get, Ozempic, Wegovy, or any semi-glutide for diabetes, but not for weight loss, what communities are you speaking to? Oftentimes historically disenfranchised communities, oftentimes historically disengaged communities, Black and brown communities. So when America coughs, Black America gets a cold, right? And so we need to really think about long term, what are the impacts to these medications? Because it's bigger than a chronic condition. This is the way that that America continues to treat its Black citizens, and we have to pay critical attention to that.
Final thoughts, Rebecca?
Look, people, this is what I would have to say. Make sure you all are eating the best quality food that you can eat. Make sure you're moving your body daily and getting certain forms of exercise. Make sure you're drinking water, because what we're seeing right now, we all have to do our part to stay as healthy as we can in order to beat back potential genetics. With it, we have to do those basic things to stay healthy, because what we're seeing in this country right now is that they're making it nearly impossible to be able to continue to grow, to continue to age with dignity and with affordability. So that means as a community, we have to do community care. We have to take care of one another. If you have a little extra and you have a neighbor who doesn't have enough, then share it with them, because ultimately we're who we got. And what when Kuni was saying, like, this is hitting Black America hard. Fortunately, unfortunately, we're used to having a government that doesn't properly give us our due. And I say properly give us our due because we're taxpayers. We pay into the system, and oftentimes we don't get back what we put into this country. And unfortunately, we're used to that. And so we're going to have to do a lot of community care, take care of one another, make sure we have community food banks. If you are a hiring manager or if you own your own business, make sure that you're hiring folks in your community as well. Look for ways to promote and to look out for one another, because quite frankly, we're all we got. We can't rely on this federal government. And in some cases, we can't rely on the state or local government where we reside. But we're going to have to figure this out to make sure that our community is able to move forward. Because at some point, the tide is going to shift and things are going to turn. But until then, we have to figure out how to survive, and where we can, how we could thrive.
Kuni, do you have a final thought tonight?
I would echo Rebecca's sentiments. I think we have to pay attention. As someone who studied public health for a long time, this
Mhm.
is classic. This is classic. We have systemic racism, we have institutionalized racism, and we have medical apartheid. This is just it's almost like if we think back to the 1960s when you couldn't be seen at certain hospitals. We're not able to do things like that as overtly these days. So unfortunately, the hegemony has found new ways to disenfranchise Black people, to keep them poor and to keep them ill. And this is one of those ways, right? It's Rebecca mentioned, it's limiting where they get access to food from. I live in Washington, D.C., and in this particular Ward 7, it's a food desert. When you really think about where are the local community places where I can get fresh foods, you're going to see that that does not predominantly exist within Black and Brown communities. However, what you will find is a liquor store. What you will find is a fried chicken store. And this is not by accident. This is systemic. And then when you get chronically ill from eating terribly and drinking terribly and ingesting all of this sugar under this administration, you can't go to the hospital and be seen without having really, really great health insurance. You can't get the medications that you need or deserve. And so it's really critically important to pay attention to that. And I encourage everyone to look into the other countries that are doing it differently. The way the United States is doing
Mm.
it is not the only way that healthcare is done. You can only look at our neighbors to the north, Canada, where they can get healthcare just about anything for free, for pennies on the dollar. And it's not because their healthcare is less sophisticated than ours. It's because they've taken an interest in ensuring that their constituents are cared for with dignity. And so that's not something that we can't do here in the United States, one of the richest countries on earth. It's something that we're choosing not to do. And so when people go out to the polls, even this year in 2026, I want you to pay attention to what that means for you, what that means for your family, and what that means for people that look like you, particularly when it comes to your health.
Dr. Kirk, I know you said you were heartbroken about the cost of 850 drugs being at least 4% more expensive. Anything else that you want viewers to know tonight about
Is
this?
that I want to echo what these two amazing women have said, in that we have to collectively work as a community, and we have to prioritize and emphasize our Black health, mental and physical, and, to be honest with you, spiritual, to carry us through the moments that we're living in this country. We cannot trust our government, and we cannot trust the agencies that are there. And we really also cannot trust most media sources to give us the information that we need about what's happening. We had a massive surge in influenza A, subclade K, and it was hardly mentioned and talked about on the news until it was already widespread. And many Americans were encouraged to not get vaccines from our federal government, encouraged to not to vaccinate our children to protect them and their health. We're seeing a surge in measles cases in South Carolina, a disease that was almost completely eradicated and hardly even mentioned, now taking a toll. We're seeing more and more children actually die from these diseases because they haven't had their MMR vaccine. We have to inform, educate our own community, and we have to care about them as well. I grew up in rural Mississippi. I grew up on plots and acres of land that's still within my family. And we had 6 gardens every single year, 6 huge fields, one dedicated to watermelons, one dedicated to corn, several dedicated to greens and beans. And we farmed in the all year round. We had summer crops, spring crops, and we also had winter crops like potatoes, and we had turnips, we had rutabagas. That is how I grew up. That's what we ate. That was a sustenance that sustained us. And now, in hearing and thinking about this in terms of affordability, in terms of what our ancestors went through to survive hard times, we're ill prepared. We're ill equipped. We don't have the same mechanisms of the ancestors to endure. And we need to know that. We need to own that. We need to start being prepared for what is to come. And the only way that we're going to sustain and the only way that we're going to survive is within community together. And we each have a role to play. My role, like Roland's, like the ladies on this panel, is to inform, is to educate, is to be a voice out there doing that work. That's why I'm here on social media at This Activist. And I encourage everyone out there watching to find out, what is your role? What are you called to do in this moment for us, for the Black community, and do all that you can to do it and do it well.